Imagine a silent enemy hidden waiting to strike. It sounds like a spy thriller, right? But this enemy is real, and it could be right inside you. This enemy is invisible, silent, and potentially fatal. It's an enemy that can be fought, but only if detected early. It's an enemy that 1 in every 8 men will encounter in their lifetime. This enemy is prostate cancer. So how can you detect it before it's too late? Sign number 1. You're rushing to the bathroom more often than a kid guzzling soda. Imagine this. You're out with friends, enjoying a game or a meal, and you find yourself needing to use the restroom. Again, and again, and yep, again. Doesn't sound like much fun, does it? This could be more than just an annoyance. It might be the first warning sign of prostate cancer. Here's the deal. The prostate is located just below the bladder. When it becomes enlarged, as it does with prostate cancer, it can press on the bladder. This pressure can cause an increase in the need to urinate. It's not just the frequency, but also the urgency. It's like your bladder is an alarm clock that just won't stop buzzing. So if you're noticing these changes, don't just brush it off as one of those things. It's your body's way of waving a red flag. So if you find yourself mapping out all the restrooms in town, it might be time to see a doctor. Sign number 2. Your urine has a frightening new ingredient: blood. Now, don't panic just yet. Blood in your urine or hematuria can be caused by a variety of conditions, not all of them serious. However, it is one of the warning signs of prostate cancer. Prostate cancer is a silent enemy, often showing no symptoms until it's advanced. When it does start to signal trouble, one of the signs can be blood in your urine. This happens when the cancer causes changes in the prostate gland, leading to bleeding that ends up in your urine. Seeing blood where you shouldn't can be alarming, and rightly so. It's your body's way of waving a red flag saying, hey, something's not right here. But remember, it's not a definitive diagnosis. It's a sign that you need to reach out to a health professional, get checked, and rule out any serious conditions. Remember, seeing red where you shouldn't can be a red flag. Signs number 3 and 4, problems in the bedroom and a new kind of discomfort. Let's talk about the elephant in the room, or rather the bedroom. Erectile dysfunction, or ED, is our third warning sign. This can be a touchy subject for many men, but it's important to address. It's normal to occasionally have difficulty achieving or maintaining an erection, but if it's happening consistently, it could be a sign of an underlying health issue, and yes, that includes prostate cancer. ED can occur when there is a problem with blood flow, nerve supply, or both. And since the prostate is closely linked with blood vessels and nerves needed for an erection, changes or problems in the prostate can lead to issues with sexual function. It's crucial to remember that ED can also be a side effect of many other conditions or lifestyle factors, so don't panic, but do take it as a signal to have a chat with your doctor. Our fourth warning sign takes us to a new kind of discomfort. This is often described as a deep, dull ache in the pelvic area, lower back, or even the hips. It might seem like just another sign of getting older or the result of too much heavy lifting. But when this discomfort becomes persistent, it's not something to be shrugged off. It could be a sign that something is going on with your prostate. The prostate is located just below the bladder, so any changes in its size or condition can cause discomfort in the surrounding areas. Just like with ED, this discomfort can have other causes too, but it's a signal that shouldn't be ignored. So there you have it, the third and fourth warning signs of prostate cancer: erectile dysfunction and persistent discomfort in the pelvic area. Uncomfortable topics? Perhaps. But remember, knowledge is power, and the more you know, the better you can protect your health. Uncomfortable? Yes, but ignoring these signs, even more uncomfortable in the long run. Signs number 5 and 6, pain that won't quit and weakness that just won't let up. Now we're moving on to 2 of the more serious symptoms that could indicate prostate cancer: persistent bone pain and weakness or numbness in the legs or feet. Let's talk about persistent bone pain first. It's not just the occasional ache or twinge we all experience now and then. This is a constant nagging pain that doesn't ease with rest. It may be focused in the lower back, hips, or thighs. This pain can be caused by the spread of prostate cancer to the bones. You see, prostate cancer cells can break away from the tumor in the prostate and travel through the bloodstream to the bones. This can cause pain and, in severe cases, fractures. Now onto the 6th warning sign: weakness or numbness in the legs or feet. This can be a subtle symptom, and it's easy to dismiss as just a sign of getting older. But here's the thing: prostate cancer can press on the spinal cord, which can lead to weakness or numbness in the lower body. This symptom is often accompanied by difficulty walking or a sudden inability to control the bladder or bowels. Remember, these symptoms don't necessarily mean you have prostate cancer. They can be caused by a variety of conditions. But if you're experiencing persistent bone pain or weakness in your legs, it's essential to see a doctor. It could be a sign of something serious. Prostate cancer is a sneaky enemy. It can creep up on you with symptoms that are easy to dismiss or ignore. But understanding these warning signs and taking them seriously can make all the difference in catching this disease early. Persistent pain and weakness are not just signs of aging. They could be your body's SOS signal. Don't ignore these calls for help. Listen to your body and take action. Signs number 7 and 8. Unexplained weight loss and swelling in the legs. Let's dive right in. Unexplained weight loss is a bit of a tricky one. You might be thinking, hey, I've been trying to lose a few pounds, this is great. But hold on a second. If you're shedding weight without any changes to your diet or exercise routine, it's cause for attention. It's a common symptom of many conditions, but yes, it can also be associated with prostate cancer. When we say unexplained, we mean exactly that. If you're not actively trying to slim down, and you're losing more than 5% of your body weight over a 6 to 12-month period, it's time to have a chat with your doctor. Remember, an ounce of prevention is worth a pound of cure. Now moving on to sign number 8, swelling in the legs or pelvic area. This is often overlooked because it can be attributed to a number of things, like standing for long periods or a salty meal. However, persistent swelling could be a sign of something more serious. Prostate cancer can cause fluid buildup in the legs and pelvic area. This happens when the cancer blocks the lymphatic system, which is responsible for draining excess fluid from your body. The result? Swelling, known as lymphedema. It's not usually painful, but it can be uncomfortable and affect your mobility. So if you notice any unusual puffiness in your legs or pelvic area that doesn't go away, it's time to take note. And if it's accompanied by any of the other symptoms we've discussed in this series, you should definitely be reaching out to a healthcare professional. In conclusion, it's important to remember that these symptoms don't necessarily mean you have prostate cancer. They can be signs of other health conditions too, but it's crucial not to ignore them. Weight loss might seem like a win, and swelling might be easy to ignore, but they might be signs your body is fighting a battle. Listen to your body. It's the only one you've got. Knowledge is power, and you've just armed yourself with valuable information. You see, life is a magnificent journey, but to truly enjoy its essence, it's crucial to stay healthy and vigilant. We've walked through the 8 warning signs of prostate cancer together, and I hope you've taken them to heart. Remember, frequent urination, blood in urine, erectile dysfunction, discomfort, pain, weakness, weight loss, and swelling. These signs are not just words on a screen, but potential life-saving alarms that your body might be sending out. The importance of recognizing these signs cannot be overstated. If you or someone you know start to notice any of these symptoms, don't hesitate. Seek medical advice immediately. It's all about being proactive, not reactive. Early detection is the key to combating prostate cancer and can mean the difference between life and death. It's not about instilling fear, but about inspiring action. But there's more to this journey. This video is just the beginning, the tip of the iceberg. There's a wealth of health insights, tips, and strategies waiting for you, all aimed at not just helping you live your life, but truly master it. So if you found this information valuable, if you feel empowered, then join us. Hit that subscribe button. Let's continue on this journey together, learning, growing, and paving the path to a healthier, stronger you. For more health insights and life-saving information, hit the subscribe button. Don't just live your life, master it.